Hi there, it's J. Mark Lopez Bello, a nursing student of Mindanao State University Buog Campus, and I will be walking you through this educational training. Today's discussion is about smoking, its impact to our health, and the benefits of smoking cessation. Our objective is to promote awareness on the dangers of smoking and the benefits of smoking cessation. Now let's jump into our discussion. Smoking addiction remains a significant public health concern affecting individuals worldwide. As we all know, smoking has a harmful effect to our body. Smoking affects the body in many different ways. But how exactly does smoking harm? Smoke from tobacco contains many chemicals that are harmful to the body. To name a few, it contains hydrogen cyanide, carbon monoxide, ammonia, nicotine, and cancer-causing chemicals such as acetaldehyde, arsenic, benzene, beryllium, and more. These chemicals are harmful to human health and may lead to serious health-related problems. You see, there is no safe level of smoking. Smoking even just one cigarette per day over a lifetime can cause smoking-related cancers and premature deaths. When a person puffs on a cigarette, a toxin called nicotine is carried into the lungs via smoke particles, where it is absorbed into the blood and makes its way quickly to the brain. When nicotine enters the brain, it causes the brain to release more dopamine, a chemical that signals pleasure, which keeps them addicted to nicotine. The chemicals in the smoke also causes constriction of blood vessels. This forces blood to move through smaller spaces. These can damage the walls of the blood vessels over time. The blood vessel walls becomes thick and hardened. There is an increased risk of blood clot forming, which can cause stroke or even a heart attack. Smoking weakens bone and can even cause eye diseases. Smoking harms nearly every bodily organ and organ system in the body and diminishes a person's overall health. Smoking causes cancers of the lung, esophagus, larynx, mouth, throat, kidney, bladder, liver, pancreas, stomach, cervix, colon, and rectum, as well as myeloid leukemia. Smoking can also cause heart disease, stroke, aortic aneurysm, chronic obstructive pulmonary disease, diabetes, osteoporosis, rheumatoid arthritis, age-related macular degeneration, and cataracts, and worsens asthma symptoms in adults. Smokers are at higher risk of developing pneumonia, tuberculosis, and other airway infection. In addition, smoking causes inflammation and impairs immune function. Imagine all this disease can be possibly acquired by smoking. The negative health effects of smoking are well established, and the best way to prevent this numerous number of disease is to quit smoking or to not start smoking at all. Making the commitment to quit smoking is one of the best choices that smokers can make for themselves. Most people know that smoking is bad, but most patients might not understand the severity of smoking. Quitting takes place. Patient must realize that they will have periods of relapse and remission. Quitting can be tough, but it is possible. Due to the nicotine, smoking is very addictive. When a person smokes, hundreds of toxins and chemicals enter the body. Nicotine is one of it. When nicotine reaches the brain, it releases a chemical called dopamine, which gives the feeling of pleasure. After a few minutes, this feeling goes away. It makes the smoker restless and have an urge to light up another, and the cycle continues. This is how smoking becomes an addiction. But how can you stop this addiction? Nowadays, there are many ways to help smokers succeed from quitting. This includes joining a smoking cessation program, counseling and medication, and more. What helps is to first acknowledge that tobacco dependence is a chronic condition that is hardly ever overcome in one attempt. You might try to quit for a few days and have an episode of relapse, and that is totally normal. Think of it as a process. Fortunately, there are numerous effective treatments that can be used and repeated when you are attempting to quit. Now, why should you stop smoking? Think about it this way. Quitting is beneficial to you and the people around you. For yourself, quitting from smoking is the best thing you could do to yourself. Think about the list of actual problems related to smoking you can get rid of from quitting. For the people around you, exposure to secondhand smoke is as deadly as smoking. Think about the possible danger your family could get from secondhand smoke. Now, what happens when you stop smoking? Within 20 minutes of not smoking, your blood pressure and heart rate will return to normal. Within 2 hours, nicotine cravings begin, causing moodiness, tense feeling, and even difficulty sleeping. These are expected physiological responses since nicotine produces more dopamine than normal. After a month, the risk for developing type 2 diabetes, cancer, and cardiovascular disease has already decreases. In 3 to 9 months, the damaged cilia in the lungs are almost fully repaired. Around 1 year, the risk for developing heart disease as a direct result of atheroma formation, a deposit of fatty materials from deteriorating arterial walls, decreases by almost one half. In 10 years, the chance of developing lung cancer decreases to half of someone who did not quit. In 15 years, the risk of heart attack decreases to the same as someone who has never smoked ever. Now, this guideline is not definitive, and the average amount of smoke per day or year will play a significant role in how well your body recovers. And fortunately, there will always be some irreversible damage to the lungs and increases susceptibility of various lung disease. Quitting may be quite difficult, but the benefits of quitting greatly outweighs the initial withdrawal. Ultimately, the best way to prevent this from happening is to not begin smoking in the first place. This concludes my video. Thanks for watching.